is CDC stands ready to work with local officials as they tailor their plan for reopening their schools. But we're all committed to getting our kids back in the classroom and getting them back in the classroom this fall. With that, I want the Secretary of Education to reflect on the efforts she's making here at the Department of Education. Then we'll hear from Dr. Redfield, and then a few wrap-up comments from Secretary of HHS before we go to questions. Madam Secretary.
Thanks, Mr. Vice President. Thank you so much, Mr. Vice President. Thanks for hosting the task force here today. We are so grateful to the President and to you for your leadership on doing what's right for students. Yesterday we had a really good and important conversation at the White House with local leaders and great teachers and parents. It was insightful and inspiring. And as Mrs. Pence noted, these past few months parents have worn multiple hats. They really are our unsung heroes. And I might add, as the Vice President noted, as are the teachers who were often playing dual roles as parents themselves and continuing to help their students learn. She also said, Mrs. Pence also said, that as we reopen businesses, restaurants, theaters in our country, we simply can't leave out our schools, and that is so correct. Students can and must continue to learn full-time. I've been really inspired by the innovative teachers, schools, and their communities that have kept learning going through this past few months, and they're getting ready to do it again this fall. A couple of great examples in Harlem and the surrounding boroughs in New York. Success Academy moved to distance learning in 1 week using multiple technology platforms. Teachers there insisted on learning new materials right along with their students. The students were still graded. They made sure all the students had the needed tech that they did not maybe have at home initially. Miami-Dade County used existing instructional continuity plans to make a seamless transition to distance learning. They added interventions for students who were struggling already before the pandemic. The International Leadership Academy in Texas started from the mindset that not learning wasn't an option for any student. They delivered multilingual and special education curriculum to all of their students. There were a number of schools and districts across the country that did an awesome job of transitioning this spring. And there were a lot in which I and state school leaders were disappointed in that they didn't figure out how to continue to serve their students. Too many of them just gave up. The Center for Reinventing Public Education said that only 10% across the board provided any kind of real curriculum and instruction program. And as I said, I've talked to all of the state school chiefs at least once, most of them more than once, and they've told me that while many of their districts in their states have done well through the past several months, a number of them they were very disappointed in doing next to nothing. And then we see, as we talk about reopening schools, there are some creating false paradigms for the fall. And here, right in our neighborhood, the D.C. area, Fairfax County, which is one of the most well-funded, I would call it an elite public school system in America, offered families a so-called choice for this fall, either 0 days in school for their students or 2 days. And their springtime attempt at distance learning was a disaster. But I give this as an example because things like this cannot happen again in the fall. It would fail America's students, and it would fail taxpayers who pay high taxes for their education. Ultimately, it's not a matter of if schools should reopen, it's simply a matter of how. They must fully open, and they must be fully operational. And how that happens is best left to education and community leaders. I really appreciate something that Secretary Azar reiterated yesterday at the White House. It's the Surgeon General's prescription for health care, and I'm going to repeat it again because it bears repeating. First, ask yourself, what's your individual circumstance? Are you or is someone in your home vulnerable? Second, what's going on in your community? Is the virus widespread or is it isolated? And third, think about the kind of school activity that you're thinking about how to accommodate and deal with? What needs to be in place for things to be successful? Education leaders need to examine real data for their own states and communities and weigh the risks. Local leaders in every community need to ask these questions and consider all the risks. Physical health and safety are factors. So is mental health. Students physically present in school. Fully open and fully out.
Plan to accomplish that. Thank you.
Thanks, Dr. Redfield. Opening up schools is the right thing to do for our kids, so they don't fall behind academically, and also so that children that are in need of services, special needs children, children with mental health issues, nutrition needs, have the support that they receive at the schools. It's important, though, for parents and for working families, and I asked Secretary Scalia to be here from the Department of Labor to speak about the impact on as we put America back to work, making it possible for us to have single parents back in the workforce. It's essential that we get our schools open as well. And so I wanted Secretary Scalia and then, of course, Secretary of HHS to finish our remarks before we go to questions. Mr. Secretary.
Thank you. Mr. Vice President, it's good to be with you all today. For reasons that Secretary DeVos has mentioned, that the Vice President mentioned, of course, having our schools open is so important to our children's education. But as the Vice President has said, it's very important as well to working men and women across the country who need to be able to structure their work days in a predictable manner in the expectation that schools will be open and their children will be able to be in school, so that the parents in turn can have a predictable schedule that they bring to the workplace. Of course, that's important to our business places as well, and in that sense, it's really critically important to our national reopening. One study has suggested that if we closed all our schools and daycare for just a month, just hypothetically, if we did that, the impact on U.S. productivity would be on the order of $50 billion. It gives you some sense of the impact having our schools closed can have on our national recovery. I did want to mention a couple of groups in particular to whom this is very important. First, lower wage workers. One of the great triumphs of the economy that we enjoyed until the virus came was how well lower income men and women were doing in the workplace. We, as you know, had unemployment that tied a 50-year low. We had record low unemployment for African Americans, Hispanic Americans, and others. And we had rising wages. Wages actually rose about 15% for lower income men and women during the first 3 years of this administration. Unfortunately, and a number of people have observed this, it's the lower income workers who've been particularly adversely affected by some of the shutdowns that we've had in response to the coronavirus. Unemployment among the lower income workers has been higher than for other populations, and therefore for them having schools reopen so that they can themselves have predictable schedules, be able to return to the workplace is going to be very important. They hold jobs that are less likely to be jobs by which you can telecommute. I think many of us know that even telecommuting, there are burdens being placed on mothers, fathers who are getting up a little bit earlier or staying up a lot later to get work done, to plan around caring for their children in the interim. But for lower income men and women, that option often is not even available. And then second, let me comment briefly on working women who studies show, and I think experience of many of us reflects, that it's women in the household who quite often bear the larger burden when it comes to caring for children. Studies show this. And again, prior to COVID, another great success of the economy we're enjoying was the employment rate for women. The unemployment rate for women was actually lower than for men right before the virus came. But unfortunately, and this is a statistic we've been tracking, we see that the unemployment rate for women now is higher than it is for men. Now, we made great progress in June. The Vice President mentioned the Extraordinary Jobs Report. We've put 7.5 million Americans back to work in just 2 months. And the unemployment rate for women dropped nearly 3% in June, but still, we have important work to do, and we know that working women will have a harder time getting back to the workplace. They continue to cite child care at a much higher rate than men do as a reason that they're not able to work. And so for them, too, reopening our schools will be very important. Just to wrap up, in such an important sense, the pace and structure of our national life is built around the expectation that our young people will be in school in person during the school year. That's so important for them, but it's also vitally important for their parents, and in that sense, so critical to this reopening that is proceeding very well economically, but to keep going, we need our schools open in the fall. Thank you very much.
Great. Thank you, Gene. Mr. Secretary.
Well, thank you very much, Mr. Vice President, for your leadership of the President's All of America approach to combating the virus and for the focus that you're now putting on getting our kids safely back to school. From HHS's perspective, reopening schools safely may be the single most important thing that we can do to support healthy families during this pandemic. All decisions about undertaking activities during COVID-19 have to look at risk as a continuum, not a binary question. States and school districts can think about the same things that we urge individuals to think about. As Secretary DeVos noted, our Surgeon General has come out with his prescription for health. Ask yourself 3 critical questions. Where are you? Is there significant community transmission of the virus in your area? Whom are we talking about? Children are much less susceptible to severe outcomes from the virus than adults. And what activities are we looking at? There are more and less risky activities for schools, like keeping kids in the same classroom versus changing classes, avoiding large gatherings, and doing activities outside whenever possible. Reopening schools comes with some risk, but there are risks to keeping kids at home too. At home, kids aren't benefiting from social stimulation. They may be falling behind in learning. They may be more vulnerable to abuse that goes unreported by the mandatory reporters in our school system. They may not be getting special services they may need. They may not be getting the nutrition that they get at school. And it may be difficult for parents to get back to work, as Secretary Scalia noted. This issue, like so many considerations around safely reopening, isn't about health versus the economy, but about health versus health. All of this is why the American Academy of Pediatrics has strongly recommended beginning with the goal of having students physically present in school. This goal is the right way to use the extensive guidance that CDC has put out to help each state and school district think through a safe reopening. Last week, we put out guidance around testing for K through 12 schools. This guidance, like our guidance for colleges and universities, offers recommendations for how and when students, teachers, and staff should be tested. While CDC does not make a recommendation in favor of universal testing, it's a perfectly appropriate surveillance technique where the capacity exists, and capacity is growing all the time. We've talked with colleges and universities that are able to use their research lab capacity with pooling of multiple samples to test their whole student bodies and staff frequently, thanks to regulatory flexibility that CMS and the FDA have provided. Many of the leaders we heard from yesterday at the White House School Reopening Summit are doing testing before returning to school and then sentinel surveillance. On top of that, the measures we recommend universally, like keeping a distance, wearing a face covering, and frequent hand washing, are effective and can be applied in the college or the K through 12 setting. We put out the CDC guidance to enable and support states and school districts in reopening safely. We want them to use the tools available to reduce risk, and we'll be putting out more guidance on how schools can use each of these tools, such as face coverings. On top of that, I will reiterate that our set of tools is expanding all of the time. Just yesterday, we signed a new agreement with Regeneron to provide nearly $500 million in support for a promising therapeutic, all the way to manufacturing hundreds of thousands of doses for the American people. The initial doses, pending approval, would be available as soon as the end of this summer or early fall. That is the first of a number of therapeutic agreements that we will do under the President's Operation Warp Speed initiative. Promising therapeutics are already being administered every day by our heroic healthcare workers. I want to thank these heroes who continue to put themselves at risk, caring for those suffering from the virus. We know many frontline workers have gotten sick, and we know some have given their lives, including some of my employees in the Indian Health Service. And America is deeply grateful. It is because we are making progress against the virus and learning more about it every day that we can talk about how to bring America's kids and teachers back to school safely. We have the tools to do it, and it has to be a top priority. So thank you to President Trump and the Vice President for putting such a focus on this very important aspect of our road to recovery. Thank you.
Thank you. Right here, please. Here we come.
Mr. Vice President, in the President's call to reopen schools, is there a situation in some states that the health situation doesn't allow for this, where you would be supportive of some states continuing distance learning? And we now see the President threatening to cut off funding for schools. Is that a serious threat, and what would that look like?
Well, the principle behind our approach to this coronavirus pandemic has been to provide federal support as states manage their own response. And what I can tell you is in the weekly reports that we provide governors, we're down to the county level in terms of where the new cases are, where the positivity lies. And I think we would account for the fact that while we hope every school in America is able to open this fall, there may be some states and local communities that given cases or positivity in that community may adjust to either a certain set of days or certain limitations. And we'll be very respectful of that. What the President's made clear, though, is that we think it's absolutely imperative that every state and territory in this country make steps and take steps, rather, to get kids back in the classroom to the fullest extent possible. We really believe that every state has the ability to do that, but for those individual communities that may be seeing outbreaks, we'll work with them, give them the guidance and the support to be able to implement the policies that they deem are most appropriate. Our mission here is to safely reopen our schools, and as you've heard from all of these members of our task force, it's not just about kids learning and not falling behind academically. It's about all the vital services that children receive at our schools. It's about working families. It's about opening up America again. And so we'll continue to drive on that. On your second point, I would tell you that at this point, I think 90% of education funding comes from the states, roughly 10%, depending on states' budgets, come from the federal government. And as we work with Congress on the next round of state support, we're going to be looking for ways to give states a strong incentive and an encouragement to get kids back to school. Please, go ahead.
Thank you, Mr. Vice President. The President tweeted this morning that he disagrees with the CDC's very tough and expensive guidelines for reopening schools. Do you also disagree with those guidelines? And are you concerned that you may be putting the health of students and teachers at risk by trying to meet the President's demand to reopen?
Well, the President and I spoke about that this morning, and I think what you will see in the coming days, what you heard from Dr. Redfield yesterday at the summit and again today, is very consistent with the President's objective and the concerns that he's raised. We don't want the guidance from CDC to be a reason why schools don't open. We want to partner with states, with local education officials, with governors, with local health officials to find a way to meet their needs to open up. And I think the President's statement this morning was simply reflective of that desire. But we remain very confident that as we continue to provide resources, we're seeing not just K through 12 education. I mean, all 47 states and 2 territories have already published plans and guidance for reopening their schools. And we reiterated to the governors earlier this week and again at the summit yesterday that we're really here to partner with them to achieve that. And I think what the President was saying this morning is that if there are aspects of the CDC's recommendations that are prescriptive or that serve as a barrier to kids getting back to school, we want governors and local officials and education leaders to know that we're here to work with them to support the measures they're putting into place. But I think that every American knows that we can safely reopen our schools, and we want, as the President said this morning, to make sure that what we're doing doesn't stand in the way of doing that.
Can I just follow up on that, sir?
Go ahead.
Just to follow up, when we're talking about the health of children, though, shouldn't the guidance be tough, and should no expense be spared?
Well, I'm going to ask Bob Redfield to speak to that. One of the things that we have seen, and I tell you, as a parent, as much as your vice president and the head of this task force, I've been grateful for it. Is that apart from having an underlying health condition, children do not appear to be susceptible to serious illness from the coronavirus. Dr. Burks can speak to that statistically on a global basis, and that's been a blessing for Americans and American families. And so, as Secretary Azar just said, we know that the risk of serious illness to children is very low, and there are measures we can put into place to make sure that we don't see the spread of the virus or outbreaks in individual schools by having children learn in a single classroom or learn outside as often as possible, not go into larger settings. And this is all the kind of guidance that the CDC is putting forward. But I'm going to let Bob Redfield speak to that because we really do believe that we can open these schools safely, given what we've seen in terms of outcomes among children, and also the kind of measures that we think we can put into effect to prevent the spread.
Thank you, Mr. Vice President. I think it's really important to be clear that our recommendations to open these schools are really based on the sound public health and safety and health of children. I think you heard already from some of the speakers, there's substantial health consequences that we've seen as a consequence of schools being closed, whether it's access to mental health services, whether it's access to nutrition. Clearly, we know a lot, and I think it's important that we don't react emotionally, but we act based on data. Clearly, the ability of this virus to cause significant illness in children is very, 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 very limited. We know of the post-immune inflammatory disease that you've heard about, but it's very rare. But in general, this virus does not cause significant illness in children. Secondly, and I think it's important, unlike influenza, where one of our biggest concerns is we've been able to show that it's really schools and children that become the instrument of transmission throughout our community. With influenza, we really don't have evidence that children are driving the transmission cycle of this. The most important thing as we reopen schools, and as I mentioned before, we're prepared to work with every school and every school district to help them find the right mixture of strategies for them to do this safely. Our recommendations are not requirements, and they're not meant to be prescriptive. We have lots of different options on how the schools can put it together. But what we do want to reiterate as we reopen schools is to remember the importance of protecting the vulnerable. That we will be strong on. It's important to limit the ability of individuals with significant comorbidities, individuals that happen to be elderly with comorbidities. We want to limit those individuals, their interactions in general in society, independent of the schools.
Thanks, Bob. And let me say just also in response to your question, I would recommend that every American review the statement issued by American Academy of Pediatrics that released an important report indicating that there are real physical and mental costs for children to be deprived of an in-classroom setting. Ranges from nutrition to children that have special needs. We heard from Dr. McCants Katz that some 7 million children in America deal with mental health issues, and the services and the counseling they receive at their schools. And so we want to put the health and well-being of our kids first. And given the fact that children, as Dr. Redfield said again, do not appear to be susceptible to serious outcomes from the coronavirus, we want to put the totality of their health and their well-being forward. And that all tells us, it tells the President, it tells this task force, that means we need to get our kids back to school. Please.
Thank you. You articulated the problem, the myriad risks that students face if they stay out of school come the fall. Mm-hmm. But what's the plan? What's the administration's specific plan in terms of increased testing, contact tracing, increased PPE if it's needed to support these schools? As you well know, schools weren't built for students to socially distance. They were built to pack in as many kids as humanly possible, which is one of the reasons why school districts like Fairfax, Virginia, the school district in New York, or Texas, they have moved to this hybrid approach, some virtual learning, some in-person learning. So what's the plan? And then I have a question for Dr. Birx about kids and COVID, if I may.
Well, the plan is to continue to do what we have done from the very beginning. As you heard again this morning, we're at, I believe, 39 million tests that have been performed all across this country. You heard Admiral Girard describe the extraordinary commitment in just one community alone, and what we've conveyed to governors is whatever support they need to get kids back to school, we're going to make sure that they have. We're going to make sure that they have the testing resources. We're currently educating states on the possibility and working with commercial labs on the possibility of what's called pooling, so that literally there could be one test run on, say, 10 samples, and there are particularly universities that already have built into their plans the idea of testing all of their students at the beginning of the academic year and then doing surveillance testing. But we've made it very clear, whether it's testing, whether it's personal protective equipment, or other resources, that we stand ready to provide those resources to the states, and we reiterated that once again to the governors. But the good news is, because of the historic mobilization that President Trump initiated, we literally have hundreds of millions of supplies of personal protective equipment, 59,000 ventilators in the Strategic National Stockpile. Testing is scaling all across America, and we know that come the school year, we'll be ready to meet those needs. But question?
Dr. Birx, what's the infection rate among children, and what's the very latest in terms of how the virus presents in children, how children transmit the virus to older adults? Nearly a third of teachers across this country are age 50 and older. And what's the best practice in terms of testing children? I've never heard of a case where a school child is tested for COVID-19.
Those are all good questions, and I think it really comes to the evidence base of what do we have as far as testing in children. So if you look across all of the tests that we've done, and when we have the age, the portion that is then the lowest tested portion is the under 10-year-olds. So we're putting into place other ways to get testing results from them and looking at antibody in that discarded samples and try to really figure this out, because parents have really done an amazing job of protecting their children. I think Americans have done a great job in keeping infection rates low in children and in the sheltering time, and keeping infection rates right now in this new cases. Originally, I think we saw great protection of people with comorbidities. We are worried now that as cases spread, that it's getting to the older parents and the grandparents. And I call on, again, every multi-generational household, get tested and protect those in the household. And we do know that there are children with vulnerabilities, and certainly within the CDC plan and Department of Education, it's protecting those children also from getting exposed to the virus, because we do know there are children with comorbidities. We know that there are children in America with cancer and undergoing chemotherapy. But when you ask that question, the parents have so protected their children. And remember early on, we said test if you have symptoms. And now we know that if you're under 18, the majority of you don't have symptoms. And so really figuring out, and there's universities working around the country on a saliva test. So it would be easier for children to put saliva in a tube, just basically what we call spitting in a tube, or spitting through a straw into a tube, and looking at that kind of innovation and testing. And what Admiral Giroir has been working on very hard is this antigen-based testing and getting that equipment into both vulnerable areas like nursing homes, assisted living, and other places, but also considering how a school district could use that would make it much easier to test and to use saliva. So all of those are being worked on, and it's why we've been pushing on the antigen test. I know you heard me talk about that in April. We're pushing on that because we think it is important for testing of students and testing in universities. But we have our data is skewed originally to people with symptoms and then skewed to adults over 18. And so we are looking very closely into that category by using our antibody tests.
Did you want to talk about the risk to children?
I think the Vice President covered that incredibly well. We know that mortality rate in under 25 from the CDC data is less than 0.1%, and so that has been holding. But until we know how many have been infected, we have no evidence that there is significant mortality in children without coexisting diseases. And that's what we're looking for right now, is to really make sure we've overturned every rock and understand that in deep detail.
Thanks, Dan. Yeah. Right here and then there.
Mr. Vice President, we all know the CDC guidelines are not requirements, they're advice.
Right.
And isn't the President, when he calls it too tough or impractical, making it easier for Americans and for school officials to ignore that advice?
I have every confidence that governors and state education officials and local health officials are going to implement the policies that they think are in the best interest of children and families. And I think the President's sentiment this morning, I think, is shared widely by the American people and certainly by members of this task force. We want to make it very clear that excuse me, the guidance that we're issuing is not to supplant the laws, the rules, the regulation, or the decisions at the state level. It's meant to create essentially a range of options. And what we made clear to governors on the governor's call this week specifically was that we are prepared at the CDC to sit down with state officials and to work through their plan and be able to advise and dialogue with them about the best way forward. But I must tell you that in this role over the last 4 months, I've been impressed by governors in both political parties and health officials in all of our states and our territories with the way they've put the health of their people first. But I must also say that I have a great sense talking to governors and a great sense that this is something the American people want to see happen, and governors are hearing that, they know that, and that's why you have 47 states that have already issued plans or guidelines, and we're going to work with them to make those a reality.
Last question, guys.
Okay.
Thank you, Mr. Vice President. I have two questions, one for you and then one for Dr. Redfield. Can you explain why the President is threatening to cut funding from schools at a time when educators are saying they need more so they can safely reopen?
Caitlin, first and foremost, it's what you heard from the President is just a determination to provide the kind of leadership from the federal level that says that we're going to get our kids back to school because that's where they belong. And we know based upon what our best health officials tell us that we can do that in a safe and in a responsible way. But to be clear, the current CARES Act provided $13.3 billion to support education efforts in states in the midst of the pandemic. We're going to work with Congress. We expect there'll be additional support there. But the President's just very serious for all the reasons that we discussed today. He believes, and we believe, it's absolutely essential for our children's academic development and for their social and emotional and health and nutrition needs to be back in the classroom. And we're going to provide the leadership from the federal level to do that. But that being said, I will tell you, I sense a great desire among governors around the country to find a way forward, and we've made it very clear to them that we're going to partner with them, providing them with the resources to impact that, and also the supplies.
You're saying describing it as a local decision. So shouldn't it be up to them to decide if they can safely reopen and not the president saying he's going to pressure them to do so?
Well, look, we're going to respect those unique communities that may have challenges, that have rising cases or rising positivity. And but I think you look at the nation as a whole. I think what the President of the United States has made clear is he thinks as we reopen America, we need to reopen America's schools. It's just as the President said early in this pandemic that he wanted to get our places of worship back open again. I think what you're seeing the President provide is leadership. And what we're providing from the White House Coronavirus Task Force is partnership with the governors and with state health officials, because we just got to get our kids back. I have to tell you, the best expert I know on this topic is my wife Karen, and she spoke at the summit yesterday very compellingly about how a lot of our kids are hurting out there. They're struggling with loneliness, with social isolation. The American Academy of Pediatrics spoke about that, a very forceful statement from pediatricians across the country that said, we got to get our kids back into school. And so what you're going to see, Caitlin, is the President's going to continue to provide leadership. I expect as the debate in Congress goes forward about additional resources, we're going to look to build in incentives for states to go forward. But the President's made it clear, and I think most parents in America would agree with him, that we got to get our kids back to school and we got to get them back into the classroom, and we can do it in a safe and a responsible way. Yeah, that's okay. Bob, question.
Dr. Redfield, you're talking about the guidance that the CDC has put out. It sounds like you think it is in the best interest of students and ways to safely reopen schools so far. So are you going to change that guidance because the President said that he does not like it?
Well, I think I just want to reiterate, we're going to continue to work with local states and jurisdictions. I think the guidance that we've put out gives a series of different strategies for them to consider what is the most appropriate in their unique situation to adopt again, and I want to come back to the goal. And the goal of this is to get schools reopened. I did mention, and I want to reiterate, that goal is just not a goal to reopen schools. That's a goal because we believe that's in the best public health interest of the students for the reasons you've heard. We will continue to develop and evolve our guidance to meet the needs of the schools and the states that we continue to provide that assistance to.
Thanks, guys. Thanks, guys.
I'm sorry, I can't hear your question. Go ahead.
The guidance recommends that schools have social distancing of students 6 feet apart, and that's why these schools are adopting these hybrid models, is because they don't feel they can keep students 6 feet apart within their building. So I'm just wondering if that particular part of the guidance is something you're rethinking, or do you support that social distancing inside schools? Because that's where schools, I think, are having trouble.
Well, the President said today we just don't want the guidance to be too tough. And that's the reason why next week CDC is going to be issuing a new set of tools, 5 different documents that will be giving even more clarity on the guidance going forward. But we know each school system, has unique capabilities, different facilities, and what parents around the country should know is that we're here to help. We're here to work with their governors, with their local education officials to get our kids back to school. I mean, the truth of the matter is that as we reopen America, we've got to reopen our schools for the well-being of our kids, for their academic advancement, for working families, but also, as you've heard again today, to continue the momentum that we see in this economy that we saw last week with nearly 5 million jobs created. And I want to promise the American people we're going to stay focused at this task force on saving lives, meeting the needs of our state and our healthcare workers, on protecting the vulnerable, and reopening America's economy, schools, work, and worship. So thank you all very much. We'll talk to you in a few days.